So let me welcome those who are just joining us. For purposes of those who don't know me, I put myself on the camera. So I did mention that I'm Christopher Kanema from Zambia. I work with the Zambia Environmental Management Agency. Currently, I'm in Bali attending the Minamata Convention. As you might be aware, the fourth COP is taking place in Indonesia. So I just arrived this morning and hoping I can keep up with the time difference. So it's actually 20 hours here. Yeah, so let me introduce the presenters now. I will start with, let me start with Brett. Brett Erickson is a holder of a PhD and a master's degree, and is a New York-based technical consultant, and is a actually adjunct professor of environmental health at New York University. I've known Brett, I think, for 5 years now. He specializes in chemical pollution and human exposure. He is actually behind the calculator that we are talking about today, the one that looks at economic issues, the cost of inaction, and so forth. So Brett, if you can just unmute and show your face. Hoping you are presenting from New York. Are you able to? Yeah, are you able to show your face and just say something?
I'm not. I will not show my face at the moment, Chris, because I'm ferrying my daughter to school. But when I present, I'll be presenting in 40 minutes or so, and then I'll be happy to show my face then. So, but right now I'm in a very rainy New York City. The Bali sounds wonderful. So,
yeah, kind of. Thank you, Brett.
Thank you, Chris.
You're welcome. See you later. Our next presenter is Sheila Willis. She's actually heading a department under international program at PAN, that's Pesticides Action Network, UK. Her background is in agriculture and she specializes in entomology. For the past 15 years, Sheila has been working with pesticides, and her focus has been on risk reduction. Under the CheMOPS project, she has developed a calculator which focuses on identifying the vulnerable populations. So we are happy to have you, Sheila. My understanding is that you are presenting from the UK. Are you able to show your face and greet?
I am. Thanks very much, Chris. Nice to see you. I'm like Brett. I'm also jealous that you're in Bali because it's not bad here, but I suspect the weather's nicer there. But nice to meet you all.
You're welcome, Sheila. You might join us in Geneva for the Rotterdam Convention. Yeah, so you are welcome. So last but not the least, I'm going to introduce Eloise Toini. I'm hoping I'm pronouncing it correctly. She is actually the Chief Task Manager at UNEP, which is UN Environment, under the Economy Division. I've known Eloise for, I think, likewise, is it 3 to 4 years now? She actually been working, developing projects and coordinating projects, monitoring projects, especially those that are under UNEP and the SciChem. These are focusing more on chemicals and waste. And so she is actually behind the ChemObs project, and I've known her with a DDT, alternative to DDT, with WHO. So Eloise, you are welcome, and nice to have you.
Thanks, Chris, and I'm very pleased to be here. Look forward to the discussion, and nice to see all of the participants and to see you introduce yourselves on the chat. Thanks, everyone. Thanks,
Thank
Chris.
you, Eloise. With that, we are 5 minutes past time. For those that are just joining, you are most welcome. We'll ask you to introduce yourself in the chat by giving us your name, your title, the organization you are representing, and the country. Thank you so much. May I, at this juncture, give the floor to Sheila. Sheila, you may begin your presentation.
Hi, I think there might be a change of order. Eloise was wondering if she might go first. Would that be in order?
Eloise, is it okay if you can pick it up now?
Yes, if that's okay with you and with Tatum.
That's fine.
Thank you.
Thank you so much. And may I pass on the baton to you? You have the floor.
Great. Thank you very much. And yeah, I wanted to give them a couple of slides first before handing over to Sheila and Brett to briefly introduce and kind of set the context for the work that we've been doing in the ChemObs project and with these calculators. So Tatum, if you can go to the next slide. I hope it's my one. Yeah. So the basic kind of framework and big question that we are having with all of the GEF portfolio projects on chemicals and waste is how to mobilize and just increase attention, and with attention you need resources as well. So the question here is, how can we systematically increase the resources and the attention that is paid to chemical management and chemical pollution issues, particularly in the GEF beneficiary countries. Next slide. As Chris said, I work on GEF projects in both the POPs window and the SciCam window, and under the SciCam framework, there's a kind of agreed integrated approach to financing for the sound management of chemicals and waste. And the model here, as you can see from that diagram on the right, is that there should be 3 pillars really that can all move together and work together in a kind of growing and expansionary way to increase the resources that are available. So the first one is dedicated external finance, and this is the example is GEF projects or other donor funded chemical management projects. The second one is mainstreaming. And I've put that in the bottom and the much biggest bubble of the diagram, because mainstreaming basically refers to overall development financing and government's own budgets, which, compared to the amount of funding that goes into chemicals management from external finance, the overall development financing from, development aid, and as well as kind of investment banks is much higher, orders of magnitude higher than the chemical specific financial sources. So mainstreaming is really seen as the kind of place where there's the most potential for radically increasing the resource mobilization for chemicals projects. And third of all is industry involvement. And here it's referring to the private sector, both in terms of, companies who use chemicals, invest themselves in order to, use alternatives or provide kind of safer and better control on the use of chemicals, but also the contribution from the industry to, for example, taxes and through other economic instruments that can generate resources and make them available for chemical management. Next slide. So the thing that all of those have in common is really to justify and sell a kind of chemical management needs to those three different sources, and they're all very different and have very kind of different bandwidths of interest and time available to consider chemical projects, which chemical projects can also be a little bit complicated and technical for example, general development finance, which has a much vaster scope of relevant topics. So we created the African Chemical Observatories project, or ChemObs, which, as Chris introduced from the beginning, has been going now for 3 or 4 years. And the idea was this kind of flow from observe, plan, and act. So the first step is to really observe and have data for chemical pollution, both the impacts of the pollution as well as details of where it is and what kind of chemical is there. And so under what we want to present today is the observatory tools that we've developed, which are there to collect available and ideally quantitative data on the chemicals that are in use and present in the countries, as well as their impacts on human health and the environment. And the idea of the calculators is to try and quantify that, both in terms of environmental and health indicators, but also quantify it in terms of economic impacts of poor chemical management. The second step is really to prioritize. Many countries or companies and value chains have got multiple chemical issues that they're faced with, and they have to prioritize and decide where to put their effort first. And so the calculator tools also aim to do that, help towards a prioritization, and help the prioritization to be as objective as possible and based on data and evidence. And then the third step of our project is to act on those priorities. And so in the green boxes on the right, you can see there's country calculator reports, which is kind of the observatory reports, have led to a country business case prioritizing and justifying investments. And finally, we're directly supporting field-based interventions with the GEF funds, but what we're interested in is looking at how those country business cases can also be used to attract support from non-GEF sources as well. So that's the project in a nutshell. I think that was my slide. And I hand over to, as Chris said, the brains of the project, which is basically Sheila and Brett, who've developed the calculators. Thank you. And I'm here for any questions.
Thank you, Eloise. We'll straight away go to Sheila. Sheila, you may take over now.
Thanks, Chris. Thanks, Eloise. I think you've misrepresented me there as being any kind of brains, but I'll do my best. And what I'm planning to do is just give a bit of background about how we developed one of the tools, which is the Risk and Vulnerability Calculator developed by PAN, and describe that one. And then I'll hand over to Brett to describe the economic calculator. So do I have control? Who's next slide? So yes, I'll just give you a tiny bit of background, but looking at who's on this call, you're all very expert on the kind of broader view of the risks from chemicals to human health. So then I'll quickly move on to what kinds of information we've found in different countries that would be relevant here, and what might be brought to bear on decisions about chemicals management. And then I'll describe the tool. So if we could move on to the next slide. I'm sure you're very well aware that the contribution of non-communicable diseases to health burdens around the world is increasing, and the contribution that chemicals pollution is making to that. Next slide. Next slide, please. Thanks. So those chemical pollutants come from a variety of sources, and they disproportionately affect low middle income countries. Sources from urban air pollution, for example, estimated to kill approximately 800,000 people annually. Lead exposure, for example, is estimated to kill more than 230,000 people per year and causes cognitive effects on 1/3 of all children globally. Brett knows more about that than I do. I'm sure he'll talk a bit about lead later. And pesticides, which I'm more familiar with. The current estimates are that around 385 million cases of unintentional acute pesticide poisoning occur annually, although a vast number more are not reported to medical services. And the current estimates are that around 11,000 fatalities are due to occupational pesticide exposure annually. Next slide, please. I don't know if somebody can mute. We've got some. So under the ChemObs project that Eloise just described, Brett and I, our first task was to do a sort of an inventory of what types of information was already available in the different participating countries that could be brought to bear on decisions around chemicals management. And we looked at the 9 participating countries.
Sheila, maybe you can hold on. May I request Suresh, if you can mute yourself? And this goes to everyone else. If you can just keep your mic muted. Thank you, Sheila. You can proceed.
Thanks, Chris. So yes, as I said, the first exercise was to understand what types of data was available in the participating countries already. And what we found was that there's a wide variety of information already collected in each of the countries from a wide range of sources and different institutions and sectors. So just to give some examples, all the countries had the WHO standardized health information system, which collects information from the health sector. A lot of them were doing ambient air quality monitoring, although at a fairly minimal level. A lot of the countries were doing water quality monitoring, looking for pollutants in drinking water in particular. There was information held by customs about chemicals coming into the country, although some of it was quite patchy. Even the Ministry of Finance has very relevant information about the scale of chemicals manufactured in countries in relation to taxing some of those facilities. Other institutions were collecting information about pesticide residues on food. Pure Earth, a US NGO that Brett has worked with, does a lot of toxic site identification in the participating countries. So they were generating very relevant information about contaminated sites. There's the Global Monitoring Programme under the Stockholm Convention that collects data on POPs chemicals. There were baseline assessments for Minamata Convention that generated information about mercury contamination, and various academic research projects going on in pockets here and there that were generating some relevant information. So we saw a lot of information available, well, not available, but being generated. But there were several issues that came up around how to bring that information to bear on decisions around chemicals management. Next slide, please, Chris. Next slide, thanks. So some of those problems about the data that exists included, because the data was being generated in a whole variety of different institutions and they weren't particularly communicating with each other, there was a wide range of methodologies being used, and that made it difficult to compare results from one institution with results from another. There was a lack of digitization of the results. It was difficult to share them because they might be locked into hard copy files in a filing cabinet somewhere. There was a lack of sharing of information just about who was collecting what and when. And there was there were difficulties accessing data across different institutions and sectors. So one ministry might be generating information on water quality, for example, but not particularly sharing it across the piece with those who are making decisions on chemicals management. So going back to the ChemObs program, the idea here is that its aim is to build capacity in setting up integrated health and environment observatories for surveillance and information management that could bring all these disparate sources of information together and make use of them to inform decisions at the national level about chemicals management. So there seems to be a real opportunity here to use that data more effectively to inform the decisions that are being made. And some of the tools that we've developed to support that process include the risk and vulnerability calculator that I've developed with Pan UK. So I'll describe that in a bit more detail. And that is very closely linked to a MapX system, which is a web mapping platform that displays results, but it also pulls together publicly available data that's very relevant to some of the decisions that you might want to make about your chemicals management. So it can be a really rich and helpful resource, and I'll explain a bit how we've used it later. And then, of course, Brett will describe the economic cost of inaction calculator that he's developed. Next slide, please. Thanks. So just focusing in on the risk and vulnerability calculator that I've been involved with. This is a tool for environmental management planning, and it helps planners and decision makers understand the risk level across different sites and pollutants. So you've got all these different chemicals and different problems, and how, it's very difficult at the national level to make decisions and allocate resources across those and try to understand what the relative risks are from the different sources of pollution. So this tool is designed to help with that process. And given that the countries that we visited and looked at their data had quite disparate sources of data, but there was a lot of gaps and difficulties with matching different sources of data up with each other, what we've done is we've minimized the amount of data that needs to come from on the ground assessments, and we've pulled in a lot of data that comes from publicly available sources. But it's perfectly possible, it's a quite flexible system, so it's perfectly possible to swap out information that we've drawn from publicly available sources with maybe more recent information or information that the end user considers is more accurate or more robust. So where there is locally available accurate data, that's the one to choose first, but we've provided a whole range of information so that decisions can be made where there are gaps. And the minimal source information is the kind of minimum information required and is restricted to the quantity of the chemical, well, the nature of the chemical, the quantity of the chemical, and some parameters around how likely it is to be released into the environment, how well contained it is. So that's the minimum that we need to make a kind of informed decision about a site, a contaminated site or source of pollution. And we've married that with a lot of publicly available data, as I say, any of which could be swapped out for locally available data. So we've provided hazard data for I think there's about 90 chemicals in the calculator at the moment, for which a whole range of hazard parameters are provided. They include things like mammalian toxicity, the physical characteristics of the chemical, like its volatility, solubility, and so on, as well as its toxicity to honeybees and to aquatic organisms. And we've married all that information with information about the environment around the site and how likely those chemicals are to move through air, water, soil, and food, and therefore people become exposed through those different media. And again, a lot of that information we can draw from publicly available information that's available now in the MapX system. So it will tell you, for example, what the soil type is in the area, whether there is a hospital or a school nearby the site that might be, you know, a higher risk. It tells you the proximity to open water sources, tells you the rainfall pattern and the ambient temperature, all these parameters that will influence how that chemical moves through those different media. And then finally, we've drawn on publicly available demographic information to give estimates of how many people might be exposed living within 100 metres and 500 metres of the site. So what we get out of the calculator, once we've rolled up all those different figures, is a risk score for human health and a risk score for environment. So the human health score rolls up the receptor information, including who's working on the site and who lives near the site, as well as mammalian toxicity and so on. While the risk score for environment leaves out the information about humans living nearby, but includes information that will be relevant to toxicity to aquatic organisms and bees, for example, and land use around the site. So if I can show you, if we can move on to the next slide, I'll show you a bit more about the information that we've drawn on for these calculations. This shows a site in Senegal, and we've pulled in information to make the calculations about the site from publicly available sources. And you can see two graphics at the bottom from MapX, just which shows information about both public buildings near the sites and soil type. But there's all sorts of other relevant information that we've drawn on for the calculations within the MapX system that gives you a lot of rich information about the site and therefore the risks to the local population and the environment. If we move on to the next slide, I'll show you how that rolls up into some results from the calculator. So the top graph shows the results of the calculations, and it plots the score for risk to environment against the score for risk to human health for all the different sites. And in this case, it also distinguishes between sites that are contaminated with pesticides, lead or mercury. And you can see here that in Senegal in particular, there were quite a few sites that were high risk and highly contaminated with lead. And part of that high risk for human health was the fact that they were located often in highly populated urban areas, so that increased the risk. So our estimation is that a graph like this would be very useful for a decision maker working at sort of national level to be able to look across all the different sites and very quickly see that those sites top right of the graph are coming out as highest risk for human health and environment, and therefore could be prioritized for action to reduce the risk. And then underneath that top graph, you can see a table, just an example. This is also within the calculator tool, and it just flags up some key issues that emerged from each of the sites. So if, for example, the chemical is very poorly contained, that would be flagged up in the bottom left table. In this instance, it isn't poorly contained, just in this example. It also flags up if the site is a flood risk, if it's prone to natural disasters, and if there's a high risk public building, such as a school or a hospital, within 100 meters of the site. So it's just flagging up these very critical issues in terms of risk, so that a project manager, for example, could quickly see, had the issue of poor container condition been flagged up, then a very simple conclusion from that would be that to reduce the risk from that site, those chemicals could be repacked into more suitable containers, and that would bring the risk down. Other issues that we summarised and flag up to project managers within the calculator include the number of people working directly on the site with the chemical, the number of people living within 100 meters of the site, and the number of people living between 100 and 500 meters of the site. Of course, the risk is highest to people living directly on the site and decreases as you move right among those three. And then the blue boxes just give some summary information about the chemical itself. Of course, if it's well contained, the risk is relatively lower, but this is hazard information, so it just flags up if you have a chemical that has a high acute toxicity to mammals, high hazard in terms of chronic health effects, and that includes cancer, mutagenicity, reprotoxicity, toxicity to aquatic organisms, toxicity to bees, and persistence. These are all elements that are included in the risk calculations above, but we just think it's useful to pull them out and flag them up to project managers as issues to bear in mind when they're thinking about risk reduction planning. So moving on to the next slide, please. I'll finish there. I'm happy to answer questions about the calculator itself or more broadly about the project, although Eloise is probably in a better position as far as that goes. So thanks very much, and I'll hand over to Brett now. Thank you. Thanks, Chris.
You're welcome, Sheila. Thanks a lot. That's a very useful information. As Brett is preparing to come, just a reminder that we'll be introducing ourselves in the chat. And for all the presentations at the end, we'll be handling questions. So we'll go to the chat and then we'll start answering from there. Then the presenters will be picking either questions or observations so that we have a summary of each question as we go. For now, let me hand over to Brett.
Chris, thank you so much. And could I ask for permission to share my screen? I think maybe Tatum has to stop sharing his screen and then I'll share mine. Thank you.
Yeah.
Should be this one. I think I'm sharing the wrong screen, so I'm gonna, sorry, this will just take me one moment. I think this is it. So I think now you should see the first slide of my presentation. And here, I promised I'd show what I look like. That's what I look like.
Thank you, Brett. Thank you so much. Please, you may proceed.
Thank you, Chris. So yeah, as Chris mentioned, I'm based in New York City. It's cold and rainy here today, and I have a bit of a cold, so excuse me. And I'll talk for 10 minutes or so about the ChemObs economic calculator. I think, like Sheila, a lot of this will not be new to many of the participants, but I'll still sort of go through it, and maybe it'll answer any unanswered questions. So the ChemObs economic calculator is part of this UNEP implemented project in 9 different African countries. And I'm sorry, you can see my screen now, is that correct? everyone can see my screen now. Is that correct? And just
I can see it, Brett.
Yes, we can.
thank you.
We can.
And the economic calculator is one of two different instruments developed as part of the project. The first is the risk and vulnerability calculator that you just heard about. And the last point that I'll emphasize now, and again at the end of the presentation, is that the results of the economic calculator should be interpreted as indicative rather than definitive. Just as a basic introduction, the calculator lives in an Excel document. And the reason for that is to make it very easy to use. It can be used offline, and it can be used on a range of different systems. It's available in English and French, and it accepts exposure data, and we'll talk about that explicitly, but it accepts exposure data for soil, dust, water, and food. So those are the four pathways for which it accepts exposure data. The overall approach looks at exposure. It takes exposure data and turns it into dose response. It takes the results of those dose response calculations and sorts out a cost of an action. And we'll look at each of these individually. With regard to exposure, it accepts various contaminants, including lead, mercury, and pesticides. We also have a preliminary calculation for manganese for the country of Gabon. It accepts different media, so soil, dust, water, and food. The concentration for the contamination has to be entered in milligrams per kilogram in almost all cases, with the exception of water. And water contamination should be entered in parts per billion. The user is asked to select a population size, small, medium, large, very large, and these represent populations of 100, 1,000, 10,000, and 100,000 respectively. And then population age, so children age 0 to 7 and adults above 15. The reason, we'll talk about the reason for this a little bit more in a bit, but in short, we have pretty good epidemiological information for neurotoxicants up to age 7. The data regarding neurotoxicants is a little less strong once we get up to ages 12, 13, 14. So we're being more conservative here. We're focusing on ages 0 through 7. We also have cancer data for individuals above age 15. So that's why those are the sort of two cutoffs for the ages here. We simply don't have data for individuals aged 8 to 14. With regard to dose response, we're looking at carcinogens and non-carcinogens. With regard to carcinogens, we use US EPA IRIS slope factors. These are linear slopes that are calculated based on a 1 unit increase, and that unit's defined by the slope factor. We also consider different disability weights for different cancer sites and stages. Those come from the IHME research. And for carcinogens, as I said earlier, we're only looking at adults, which we define as above 15 years of age for this calculator. With regard to non-carcinogens, we're looking at mercury, lead, and organophosphate pesticides. As I mentioned earlier, we've also developed a preliminary model for manganese for the country of Gabon. And the models we use here are derived from various methods. We look at US EPA systems, we look at WHO approaches, we look at what IHME has done. That's the Institute for Health Metrics and Evaluation based out of Seattle, Washington. And then we also look sort of fairly extensively at the peer-reviewed literature. We're also, with regard to non-carcinogens, we're looking primarily at cognitive effects. So frankly, what we're talking about is the development of gray matter in the brain, so IQ impediments as a result of exposure to neurotoxicants. The exception here is that we also look at cardiovascular effects for adults, for adult-led exposure. The cost of an action, we look at two metrics here. We're looking at the disability adjusted life year and also IQ decrement, as I mentioned. The DALI it was developed by the World Bank in the 1990s. It's now used broadly in disease estimates. And it could be understood in our economic calculations as a lost healthy year of work. otherwise also put as the expected value of commodity production. So the cost of DALYs as well as IQ are going to vary by country. They're going to vary by age range. They're going to vary by the year for which we're calculating them. So all the calculations in this calculator use 2019 data, just as a reference. And so, yeah, so they have to do with the GDP of the country, the composition of that GDP, and so on. We define an IQ point as a 2% loss of lifetime earnings. It's lifetime earnings, it's just as above for DALYs is the expected value of market output over the course of a life. And then we further discount those values for growth in GDP, for the tendency in humans to value the present more than they value the future, for the probability that one age group will survive to the next. So it's all very sort of country specific. So as a result, the values from country to country vary quite widely. With Gabon, which has the highest GDP in the 9 countries we looked at, with having the highest value for DALY. So YLD is part of the DALY calculation, but you can see here a DALY in Gabon is valued about 5,000 USD, whereas a DALY in Madagascar is only valued about 400 USD. So there's big variation in the data, but what we've done is we've calculated these for each of the countries, as well as each 5-year age group up to 65. These are the estimated lifetime earnings per age group. So the way to read this is that for a 1 to 4-year-old living in Ethiopia, he or she could expect an average lifetime earnings of $23,000. And these values are discounted. So they apply those discount rates I mentioned earlier. So an IQ point drag on this $23,000 or $24,000 would represent a 2% drag on that overall value. This is what the calculator actually looks like. And now what I'll do is I'll walk you through a sample calculation. So this is a site in Zambia. This comes from data that were entered as part of the calculator from the Zambian team. And this is a city in central province called Kabwe. And Kabwe was a massive mining and smelting complex that operated for 70 years or so through most of the 20th century. And it resulted in fairly extensive metals contamination throughout the town. So in this neighborhood, in the community of Choa, the average soil concentration is 2,000 milligrams per kilogram. So the question is, how does this individual here become exposed to this soil? In our calculator, we primarily consider incidental inhalation and ingestion of contaminated soil and dust, and we estimate that at 50 to 135 milligrams per day, depending on age. Now, let's say further that there are, in addition to this gentleman, there are 1,000 children that live in this neighborhood. And so we'll feed those values, 1,000 children at 2,000 milligrams per kilogram in Choa into our calculator and see what we get. So as I said earlier, this is, we're looking at Choa in the region of Kabwe and the country of Zambia. And the latitude, longitude are here. The population is 1,000 children. So we have 1,000 here and children here. And they're exposed to 2,000 milligrams per kilogram of lead in soil, because you can see here we're on the soil worksheet. What this calculator does is it takes those values and it estimates the total IQ decrement attributable to those exposures. So we can see that these children would lose, based on this calculator, 6,000 IQ points. So that's basically, for each kid, 6 IQ points if they lived on soil that was contaminated at 2,000 milligrams per kilogram. The adult population would lose, in terms of cardiovascular effects, we can value their attributable health losses at 16.5 DALYs. These values then shift to the front part of the calculator, which is this sort of, we call it the splashed screen. And you can see here 16.5 has become 17 and 6050 IQ points. These are disaggregated by dietary, soil, dust, water, as well as DALYs and IQ decrement. So these 17 DALYs and these 6,000 IQ points are valued for the country of Zambia at $1,400 respectively. So the value of a single IQ point in Zambia, which is 2% of lifetime earnings, is $427. And the cost per DALY is about $1,000. So then we simply multiply these values together and we get the cost per DALYs at $16,800 and the cost of IQ decrement at $2.5 million. And so this would just be for this one severely contaminated neighborhood in this one city that happens to have 1,000 children. So in summary, these values are indicative, they're not definitive. Obviously, there's a lot of variability that goes into these estimates. Everything from the collection of the sample to the demographic, so whether or not the sample is being collected in the right way, whether or not it's actually from a human exposure pathway, whether it's being analyzed in the appropriate manner at a certified lab, and so on and so forth. Whether the 1,000 children that are living there actually spend their lifetimes living on 2,000 milligrams per kilogram soil, leaded soil, or whether they're spending half their time in Kabwe versus half the time in Lusaka, and so on and so forth. And then finally, with regard to lifetime earnings, there's huge variability in lifetime earnings. So a knowledge worker, so someone who's going to be working in the Ministry of Environment or the Ministry of Health or is working in IT, to that individual who may have higher earnings, an IQ point might be more valuable in terms of raw dollars than it would be to a manual laborer. So there's a lot of variability at each step in the calculation. So as a result, it's we sort of refer to these values as indicative rather than definitive. What they do is they rely on sort of the best science and the science that we outline in the methods documents. What's useful about this calculator is that it can rapidly be used. As you can see, it's very straightforward to characterize losses in an exposed population. But these estimates really should be understood as sort of a first pass at calculating the financial burden of chemicals exposures. So a more robust calculation would really be needed to really zero in on what these things cost. But it really is just sort of a first indicative pass. Okay, thank you very much.
Thank you, Brett. Thank you to all the presenters. I think we are running out of time. I think what we can do now is to rush quickly through the questions, and may I ask that Sheila can come and introduce the first question. So instead of 20 minutes, we'll have to handle this within 15 minutes. So Sheila, kindly introduce the first question.
Okay, thanks, Tatum. Yeah, the first question we'd like to ask you is which national data sources on chemicals are regularly updated that you know of in your country or where you're working, and how is that data used? If you have sight of data sources and how data is used, we'd really like to hear more about which sources you consider the most robust and regularly updated and how they're used in decision making. So we'll see you in the discussion. Thank you.
Thank you, Sheila. So can we go in the chat and start typing our responses? We have 15 minutes. Then Sheila can come and give a reflection on this. So 10 minutes discussion and 5 minutes for Sheila to come back and do a summary. Thank you. So we are now in the chat. If you are joining us just now, kindly introduce yourself, your name, your title, the organization, and the country you are representing. And now we are looking at question 1. We have posted a link for us to answer through the link. So you may just click on the link and then respond. Kindly note that the link is only for the poll question. We still have the other question to respond to, and let's do it in the chat. Thank you.
I noticed that there's quite a few responses coming in the chat, mainly focusing on information about pesticides that are registered, and presumably Tom's comment about crop life information from industry as well coming in about pesticides. I'm not sure what type of information, maybe about which products are in common use. Do we have any information about pollution from any of these sources, or?
Thanks, Sheila. And I guess I also picked up on the comments on pesticide registers. Do they include information on the quantities of pesticides that are brought in, or is it just a list of registered products rather than quantified use and trade information? Thanks.
Thank you, Eloise. I think what I noticed is that this is coming from the Zambian colleagues. So, Lloyd, are you able to answer that one?
What's the question, sir? I'm recording from Zambia.
Thank you, Bruce. The question is the chemicals that the database on chemicals, do you also include the quantities as they come in? I think that's what Eloise was asking.
Yes, we do. First of all, we have two sources of getting data in terms of quantities. First source of information is from the orders. So major entry for the present related as ambient environment. You see? So as the consignments are coming in, the quantities are captured at that. So that is the first point of data capturing. The second one is Zambia uses, like any other country, that matter, we use the ASCUDA word system. So as the entries are entered into the ASCUDA system, at an appropriate time, we request for information from the Zambia Revenue Authority. So they would pass for all the data in terms of chemicals that came in country, depending on the period that we are looking at. If we are looking at 2021, they'll be able to pass all the information that came from January up to December in terms of quantity and product name as well as the active. So the database has got those the trade name active together with quantities. Thank you so much.
Thank you, Bruce. Eloise, is that clear enough?
Yeah, thank you very much. Thanks for that answer, Bruce.
Thank you. So may I request Sheila to just wrap up on question 1? Give us the summary from the chart and also from the polls. Thank you.
Sure, thanks, Tatum. Yeah, some interesting information coming in about particularly focusing on pesticides. I noticed that Tom was worried that the industry information was sort of dominating and perhaps there were too few other sources of information. A lot of information about which pesticides are registered, maybe less information about the impact of those pesticides or other chemicals on the ground. But a lot more information is coming in as we talk, so perhaps that's just on its way. I noticed from the poll that, could we go back to the poll, Tatum, or oh, okay, we're on to the next one. Yeah, interesting results there. Clearly, media coverage of high-profile incidents has quite some influence, and poison centre data, which is interesting. We have done some work on what information reaches poison centres and the health service in general, and that could be quite limited in terms of how many incidents are reported and how that information, how detailed that information is to give to decision makers in terms of which chemicals are causing the poisoning. So it's interesting that that's influential, and perhaps that's something that could be looked at. Routine monitoring of water and food also came out quite highly, so it's interesting that that was featured. And we're on to the next poll, but thanks everyone for the engagement. Lots of interesting information coming in, particularly focusing on the pesticide issue, so thanks for that. Over to you, Tatum.
Great. So thank you all for answering question 1. May I request Brett to introduce the next question?
Thanks, Chris. Yeah, so the question here is, as I explained, there's a large amount of variability in the economic estimates, and therefore uncertainty. So, and that's in each step of the equation, beginning with the environmental sampling data, also the dose response work. So we're projecting this into the future based on models. It's not using actual epidemiological data. And then finally, the economic costs perhaps do not adequately capture the sort of nuanced economies and differences in earning power for individuals in each country. So are these useful as they are they useful for policymakers? And if so, how? So the question we have here is, how can economic evaluations of chemical pollution like this be most useful to policymakers given the high level of uncertainty in their results? So thank you.
Thank you, Brett. So likewise, we'll answer in the chat and the poll. So can I encourage people to post their answers in the chat? Brett, you can, as we go, just answer some questions within the chat and then you come back and summarize the discussion. Thank you. So we are now in the poll. So we are in the chat. So can we post in the chat, and then we'll be looking at the polls as well. So we are in the chat and the polls are open. So you are encouraged to answer both the polls and also question 2.
An interesting point here from Trust about the social cost of the burden of care, or the burden of care. I should say that the economic costs that we use in this calculator, they do contemplate what's called non-market productivity. So it's a certain percentage of market productivity, but that would contemplate those social costs. So those costs are currently included in the value. And there's more information on that in the associated guidance.
Great. So Brett, you can now conclude on question 2 and give a summary.
Just reading this last one here, Chris, and then I'll thank you very much. So I think in general, it's and I'll answer your question last. In general, the comments are that this sort of valuation is, even with its uncertainty, seems to be useful, and the reason being that decision makers base their decisions fundamentally on the cost of those policies and on economic factors. So that's all. I think that's all very encouraging. And then there's a question here about when this Ruben asks. I'm sorry, not Ahmad. Ruben asks, when will the calculators be available globally? Oh no, Ahmad does ask that. I'm sorry, I'm all confused. Ahmad asked that. So I don't know. I think, each of these, I think, for instance, if one were interested in calculating these values for his or her country, that could be done using the guidance that's associated with these calculators. But yeah, I think it's sort of it's a bit labor intensive to calculate basically the economic values for each of the countries. So I don't know of any plans to make them available globally. Yeah, I think that's. So I think, yeah, I think that's generally it. Is that there seems to be a consensus that these are useful values for decision makers, because economics play such a key role in their making decisions.
Yeah, Brett, I think we still have one poll for people to post. So I'll ask Tatum to just post again the link, and then we should be the last poll. Then you can also discuss this one. Thank you. So let's click on the last poll. The link is now provided.
Chris, is it possible to see the results of these polls, or am I missing that? Oh, they are there. Okay, great.
Yeah, she's able to post. Yeah, so the last one looks at how can the credibility of the evaluations be improved. Again, order from most to least impactful. So you have about 1, 2, 3, 4, 5, 6 options. So you order those.
It's so interesting. Yeah, so they by demonstrating the similar approaches used elsewhere.
Yeah.
This is great. Okay, good. So it looks like the best way to make these more valuable, according to folks on the call, is that we should be presenting dose response information more clearly. I wonder to what extent that's a reflection of my presentation versus because I did sort of go through that. Oh, sorry, it seems to be changing in real time.
I think you hold on a bit because people are active in the background.
I'll wait. Yeah, I don't
let's
want to.
Let's see what happens. In case you have not answered question 2, you can still post it in the chat. And then there's a link for the polls. You can as well answer through the link. We'll be winding up in the next 2 minutes. So I'll ask Brett to discuss the results in the poll, especially for the last one. Thank you.
I guess I could just begin by going through this. So the first one here, by presenting the dose response methods more clearly. Yes, I do wonder to what extent that's a reflection of my presentation versus the methods documents, but that I think that's helpful. So I think I'd be open to suggestions on how to do that. Whether it could be like visual aids, or whether I should have. There's a methods document that's associated with that has some pretty good description. By increasing the number of environmental samples. So again, this is that 2,000 milligram per kilogram sample is based on it's based on several hundred or 1,000 samples, and that's sort of the mean value. So I think what I take away from that is that we need to convey that information more clearly to policymakers, that the quality of the science that's behind these estimates. So if the science is weak, if there's few environmental samples, that should be conveyed to the policymakers. By presenting the economic methods more clearly, I think we need to think through this a bit more. The math on this stuff is pretty complicated. So I think we need to think through how to give this information to policymakers in a way that makes sense to them. By demonstrating the use of similar approaches elsewhere, that's great. So we will, this we have not done, so I think we need to do a review of what's been done elsewhere and how this compares. So that's something I think I will do. By presenting the extent of uncertainty, confidence intervals, and by stating that those results are indicative and not definitive, I guess those two seem sort of relatively less important to folks in the call. So this was really helpful. Thank you.
Thank you very much, Brett. The last question: how could resources from government, development assistance, private sector, and donors be increased for chemicals pollution? Can I ask Eloise to introduce this one?
Thanks, Chris. Yeah, thanks for so yeah, the last question is, as you said it, really trying to think about how if these tools are the best way to try and accompany proposals for resource mobilization, and if you can think of if you think these tools are useful for that purpose, then if you can give some examples of how they might be used. And I think there's already been a couple of examples in the chat on, health budgets, etc. So examples of how you could possibly use those tools. And secondly, if there are other approaches or ways that you've had success with in trying to mobilize resources for chemical management and chemical management projects. Thanks.
Thank you, Eloise. So there you are. Question 3, we can go to the chat. Let's answer question 3, and then you see that do we have polls for this?
Yes, we have 2 polls.
2 polls, yeah. Okay, so the link will be coming through. So let's answer the question, and then we also look at the polls. So we have 15 minutes.
Thanks everyone. I'm seeing the answers coming, but it's a little bit slow. Okay, here comes some chat responses as well in the chat. So yeah, it seems that increasing the evidence base is quite a popular thing. We think this is the most realistic of the options there. Yeah, I think it kind of speaks to the use of these calculators, which are supposed to be, trying to be a bit quantitative and evidence-based, and particularly using country-based data sources rather than international data sources. So thanks for those comments. Doesn't look like private sectors is the most realistic option at the moment. Although raising awareness and increasing political will are certainly, and I guess blessings. The question is how, what kind of mechanisms do you think are most efficient at increasing the political will among all of those options, or if there are other options as well that you can think of? Great, thank you for these comments. They're coming in faster. There's very interesting issues coming out. So including from Lucy about actually occupation health and safety and kind of compensation based on the responsibility of employers and the tax scheme. So I think those two are both kind of examples of private sector engagement, which I think is kind of looking for those generally to help countries, roll those out with the private sector. Take them. Could we? I think there's another poll with basically the same questions, but these are kind of realism and impact. So I think the distinction between the two polls is, which one is most likely to actually happen. That was the previous poll, and now this new poll here is the most impactful and likely to actually, jerk policymakers into action and really make a big impact on the level of political will in practice. So that's the little explanation of the two different polls. So it has basically the same options.
Great.
And it looks
Thank you,
like
Eloise.
kind of a reverse order.
Can we go to the next poll? The link has just been posted. Maybe just take your time and look at the last poll, and then Eloise will come and wrap up. Can we have the link for the last poll?
Hi, this is the last poll. The link I'll post again.
Okay, I'm seeing the same things. Is it only me?
The previous poll asked for the most realistic, and this poll is asking for the least impactful.
Ah, okay. Okay.
So it's just different
okay.
wording.
Thank you for that clarification. So thank you. Dele, are you able to mute yourself? Okay, so I'll ask that we continue to post our responses for question 3 as we conclude answering the polls. The last poll actually orders the options we have in terms of the least impactful. So as we wrap up, I'll ask Eloise just to speak through the polls and also what has come through the chat. Eloise, you have the floor.
Thanks, Chris. And yeah, thank you everyone for your insights in this question. I think, you know, the other way to phrase the question could have been how to practically increase political will for these issues. And I think it was kind of interesting to see that the realistic and impactful ways are really, you know, in both cases, having objective and kind of evidence-led approaches seems to be quite high and one of the preferred options and the most impactful. Both the evidence base for the impact of chemicals on health and environment, but also the economic valuation aspect of it. I think it was interesting to see that in both of the polls, the private sector's buy-in was kind of seen as a less critical or less impactful modality. Although looking at the some of the chat comments that came back, it was interesting to see a sort of concept of liability and sort of having kind of an ability to make claims, and I think that's linked to a previous discussion where there was was kind of on the human rights based approach to chemicals and pesticide regulation. So I think that could be kind of an interesting angle to look at in terms of the private sector and just creating a bit more of a real modality to implement the polluter pays principle. And I think Tom also points out the role of public-private partnerships. So really the concept of a joint responsibility rather than just the private sector on their own. But yeah, I think in the resource mobilization and the political will, it definitely looks like you see the role of evidence and data-based approaches, and possibly coming from different sources, including civil society, media coverage, private sector, and slightly more kind of academic or scientific studies, and tools like the calculators that have been presented. So thank you. It was very interesting points coming up. And I'd like to thank you all for your very active participation and the very large number of people that we had today. Thank you, and thank you, Chris, and thank them for the organizing.
Hi everyone, yeah, thank you very much from the Environmental Health Division's team, especially Prof. Andrea, who unfortunately couldn't be here today, but we would just like to thank everyone for their contributions, and a special thank you to the presenters for leading such an engaging session, as well as our facilitator, Chris. I will leave open the evaluation poll, and you're welcome to still complete it. And we wish you a good day, and we hope to see you in the next session. Thank you all.
Thank you, Tatum, and thank you, everyone. This has been a very interesting discussion. Hoping we can use the lessons from here to apply what we are learning in the master's program. Thank you, and hope we can fill in the evaluation form now.
Thank you, Chair.
Thank you, everyone. Thank you, Chair.
Thank you.
Goodbye.
Thank you,
everyone.
everyone. Bye.
Thanks a lot.
Thank
Bye-bye.
you, everyone. Goodbye.
Bye. Thank you.
Thank you, everyone. Goodbye.
Thank you.